Good morning, everyone. This is Dr. Sophie Beater with another Tooth Talk Thursdays. So we're having a tooth talk a little early today because that's when I can fit it in. So just bear with me. All right, today we're going to talk about your child's first dental visit. A lot of people are under the misconception that your child's first dental visit should happen at age 3. I don't know where people have gotten that information from, but the new guidelines state, and this has been for at least the last 10 years or so, the new guidelines state that your child's first dental visit should happen after the first set of teeth erupt, or at the very latest, a year old. Okay, so we're going to talk about what to expect at the first dental visit. Gonna give some advice to the parents as well. We're gonna talk about how to prepare for the first dental visit, in terms of preparing the child and in terms of preparing yourself as the parent. All right, so what to expect at the first dental visit? Well, firstly, don't expect too much, okay? The point of the first dental visit is to get the child acclimatized to the dental environment. So it's going to be something new, it's going to be something different. So it's going to take time to break them in, right? Especially if your child is more hesitant and not so eager to try new things. So expect it to be a short visit. For me, I don't expect us to get further than the examination. If I do, then I'm happy. But a lot of the times we just leave it at the examination and then we say, oh, you did a great job and let's come back and let's try again for a cleaning. Some children will cooperate for a little mini cleaning, right? But some won't, and that's fine. Okay, they're very, very young at that age. So end it on a good note. We praise them for what they cooperated for, and then we schedule another visit in either 6 months or a year. Also, that visit is critical because we give a lot of helpful advice to parents. So we'll be giving you advice on the habits, the dietary and feeding habits. Don't let them fall asleep with the bottle in their mouth. Don't let them fall asleep with the breast in their mouth. You want to start brushing with a fluoride toothpaste. We'll tell you the amount that you need to use on the toothbrush. You can use a rag if they don't tolerate the toothbrush, or you can use a little finger toothbrushes for infants, right? And then you can graduate them up to something else when they get older. So you want to establish an oral care routine as well. So once you feed them, you either young ones, you don't want them drinking water, but we're talking like a year now. So once you feed them and they're over a year, you can give them a little bit of water to clean the mouth, right? Or if they're younger than a year, you're going to want to wipe their mouth out with a rag and some toothpaste. You can use the rag and toothpaste, and that's fine. Make sure the toothpaste is always a fluoride toothpaste. So for little babies, you want to use just a little smear of toothpaste, little smear. And as they get older, you can increase the amount. So when they're 3, it's supposed to be a pea-sized amount. So that should tell you how little toothpaste you really need to use for a baby. Okay? All right. So also, of course, we look at the teeth. We see how they're doing in terms of cavities, in terms of gum issues. We ask you what issues you're having with them. If they fight you to get in the mouth, fight you to brush, that kind of thing. And I may give some helpful advice. So the point with children is that you want to make brushing or their oral care routine as fun as possible. So cartoon characters, toothpaste that tastes like bubblegum or other pleasant things that they like. Songs when you're brushing their teeth, get them in the little routine of either humming a song, or you can sing a song to them and make it a little bit more fun to pass the time. All of those things are helpful because you have to really get down to their level as kids. And a lot of adults, we don't like to take care of our mouths. So imagine a child and you're shoving your fingers all in there trying to get that stuff done. They don't really tolerate it very well. All right, so in terms of how to prepare for the dental visit, how to prepare the child. So very important, the least amount of information as possible. Okay, now that sounds counterproductive with the parents, right? But it's very important because there are some no words that parents will unknowingly use, and it makes my life a whole lot harder. Okay, so even when you tell a child, oh baby, it's not going to hurt, the part that clicks in their head is hurt. They don't remember, oh, it's not going to. They just remember the word hurt. Okay, so there's certain no words: pain, hurt, needle, joke, stick, shot. All right, we don't use any of those words, and if you use those words, you're going to make my life a whole lot harder. Okay, so apart from the no words, you can show, and the least amount of information as possible. Depending on the age of the child, you can show a cartoon so they can see what will happen at the dentist. I know Peppa Pig has a cartoon. There's some other little cartoons on YouTube. You can just show them, you know. Or if they have an older sibling, you can video the older sibling and then, you know, you show the baby. Or you carry both of them to the visit and say, hey, look at your older brother doing this. See, he had fun cleaning his teeth. Let's try. That kind of thing. What else? So preparing the child. Okay, so we talked about preparing the child and giving the least amount of information as possible. Oh, and by the way, if you're carrying them for a filling, you can just say, oh, you know, we're going to put a band-aid on the tooth and make it all better. Least amount of information as possible. Let me do the talking, okay? All right, in terms of how to prepare yourself, and this is very important because children don't naturally know fear. Young children don't know fear. So they gauge our responses as parents to see if they should be afraid. So if you're anxious, if you're fearful of the dentist yourself, you may not be the best person to be in the room with the child, especially during a procedure, right? So you have to be prepared to be asked to leave the room if you know you're going to be anxious, because you're not going to help us accomplish what we need to accomplish with your child, because you will project your fear. Okay, you also have to bear in mind that we are, as a dentist, we are the ones in control in the dental environment. So you have to take a step back as mommy or as daddy and allow us to take control of the situation. Okay, so we can have you in there if, you know, you being in there helps the child to cooperate. And if we need to, if it's our first dental visit that involves pain, unfortunately, and we have to give anesthetic and all of that stuff, if you can be very supportive, we'll keep you in there. If we see that you can't be for whatever reason, we will ask you to leave, and you just have to respect that. All right, we know that as parents, you are concerned about your children. We are also concerned about your children, and we want to give the best care possible. And if you are a hindrance to us delivering the best care possible, then you wait in the waiting room and watch some TV or stay on your phone, and then we do what we do, and then we give you your child all mended, and then you go home and you'll be mommy and daddy all over again. All right, so as I spoke about, if you have other siblings, like older siblings, you can bring along an older sibling to do something simple like a cleaning and have the baby watch. And once they see that the baby survived the cleaning, then they'll be more likely to want to clean their teeth. So that's a good thing. I don't recommend you letting a child watch an adult do procedures, because adult cleanings are very different. All right, they may involve a lot more bleeding, and that will scare the child. Right, and I certainly don't allow children to watch fillings or any procedures that involve anesthetic or receiving anesthetic. Okay, so that's another thing. Rewarding good habits. Okay, so you can't promise them the KFC and the toy or whatever else you promise them, and then they're naughty in the chair, they don't cooperate for anything, and then you go and you buy them that KFC or you give them that toy, because you're rewarding bad behavior. So we like you to reward good behavior. So if they were really brave, and even though they were scared, they helped to do a procedure, or they cooperated for something, then for sure we can reward that. If they cooperated part of the way, right, and they weren't able to cooperate for everything, I still think that's worth noting, but still I may not give a reward for that. All right, because we want to reward good behavior. We don't give rewards before they reach in the chair. We tell them that, hey, if you sit in the chair and you do ABC, then we will reward you. And you really need to stick to that as parents. All right? Try not to let the little kiddies control you. All right. So that's basically it for your child's first dental visit. Have a good day, everyone.